I'm just here doing a PEMF session on Player. She's a 4-year-old thoroughbred, soon to be 5, but this is her first treatment that she's ever had as well. And we're just going to do a general full body treatment and address any areas that might have any issues. When we get started, we always start with the placement of the coils in the first location in the front of the wither. It's a good place for the horses to be able to feel what's going to start happening to them, especially when they haven't had it done before. They'll feel the current come through. I'm just going to turn the machine on, and I have it set on no output right now, just so she can get used to the feeling of it. And as I turn up the power, I'm watching the horse for any muscle contractions or any kind of reactions going on, watching her eyes and her face for her reactions to whether she's finding it enjoyable or if it's too high or too low. So there we have just a little bit of a reaction starting here. So we're going to leave it in this location for 2 to 4 minutes, depending on if we notice anything out of the ordinary, but an average treatment is 2 to 4 minutes per location of the coils. Okay, so once we've completed our time in the first zone, we're going to move it to zone number 2, which is just behind the wither. And here we watch because they can have a more significant reaction. So she's showing that it's a little bit too high for that area. I'm just going to turn it down. And we're going to leave it here in this spot again for the 2 to 4 minutes. And she gets used to it. And we're watching here again as the muscle contracts and changes. You can see it sort of pulsing and getting a little bit stuck. So we're trying to look for a nice smooth reaction to see the horse release. We check the eye to see that they're getting a bit more relaxed. We watch for the face. We're looking for signs of relaxation as they feel the pulse go through. And then as we move to our third zone, we're moving into the mid-back. Again, just watching for the muscles to how they are going to react as whether we need to increase or decrease the strength of the pulse coming through the coils. We tend to use the big coils to get to the most coverage on the horses. Okay, and the next location we move on to is the mid-lumbar region of the horse. In a horse like this, that's a mare that's a little bit longer in the back, you can sometimes see a little more of a reaction there. This mare is showing to me that she's nice and strong there. We haven't had to adjust the machine like we did up here, where we had to turn it down a little bit to get her more comfortable with the pulse as it was going through. Here, I would be comfortable turning it up a little bit. We have very little muscle contraction going on up there. So I'm just going to give her a little bit more power here. Perfect. Then we're going to move into our fifth location, which is the origin of the glute. I like to make sure that I get up and over the hip as well, just for any of these horses that are just starting to train. I work mostly with the hunter jumpers, and I find that their hind ends need the most attention. I do like to make sure I get around from side to side as I'm doing these horses to make sure that we're getting even pulsing on both sides, or if one side is more than the other, so that if it's an issue that needs to be addressed in training or for the human balance or any of those things. This horse is very even on both sides. All right, and then we're going to move our coils now into the sixth position, which brings us down into the hamstrings for the horse. I like to bring it down fairly slowly, and I'm very careful when I get in through to the back. I've had a few horses that are very sensitive in through here, and I have to turn the machine quite down. So I like to just pay attention. It really gets in and gets the tail activated, which is connected all into the horse's spine. And some horses you'll even see a reaction all the way up to their ears when you're doing back here. She's rather enjoying this right now. And we tend to hold the coils in each position for anywhere from 2 to 4 minutes. Watching for any sort of negative reaction or a stronger reaction and giving them a little bit more time to help them relax and release. Again, paying attention to where the feet are, watching up front, looking at the ears, paying attention to us, looking at the eye, looking for visual signs of relaxation. Okay, and now the seventh position we're going to go into is we're going to work our way up to the horse's neck. Now there's a few different ways that I have had success with this. Some horses are very sensitive through their necks and they don't like the coils touching together. As you bring them together, it does increase the strength of the field going through to the horses. So sometimes you have to let them hang and be separate. This horse's neck is not having a very negative reaction. In fact, she's quite strong, not showing any major signs of discomfort up through her front end really at all. So what you can do is I have taken my Velcro straps, because that helps to keep them together. Another way you can increase or decrease the strength of what it feels on the horse's neck if you're just getting to know them. Sometimes I will hold it up and then that gives it just a little bit more of a softer feel for them. But she, like I said, is not having any major negative reactions in through her neck. So here I would just like to turn it up a little bit for her. Again, we're looking for those signs of relaxation. A nice big yawn would be appreciated. Her eye is not concerned at all. She's enjoying herself. We're not really getting too much of a reaction on her right side. And then we'll just step around her and check on her left side. And on her left side right now, we really have no pulsing at all. So, you know, that's something when I would speak with the owner would mention that I noticed a little bit more reaction muscle-wise on the right than the left. Kind of makes sense on a racehorse that's pretty fresh off the track. So, and we would leave this here again for the 2 to 4 minutes. I tend to average about 3 minutes per location on my first treatments to get a really good understanding of the horse. And then if I find an area of injury, then I would double up the time. And now we're going to be moving into our 8th location, which is the pole, a very ignored spot on a lot of horses. There's a lot of sensitivities and issues in the pole. So I proceed with caution the first time doing a horse. You don't know if they've got, especially off the racetrack, if they've got ear issues or if they have any issues up there, and they can be quite sensitive. So I always start with just having it not quite firmly placed on the pole and gauge their reaction from there. She seems pretty good right now. So then I will slowly move it a little bit closer. The ultimate goal for me is to get it right up over their ears and bring it down the front of their face to really help them release through their jaw and release all that tension. First visits doesn't always happen, but you always get there in the end. She's actually being quite relaxed about it all. She's got her lips going, she's chewing and licking. She's quite relaxed, really enjoying it. So I will take it and just bring it gently over her ear. And then I will do the same on the other side. Now, as you bring them closer together, like I have said, it does increase the strength. So again, I just move slowly and cautiously with the timer going again, 2 minutes. As I bring it closer together, you can see she's is enjoying it quite as much. So I'll use my fingers. I won't go to the Velcros until I know that she's going to be okay with it. And we just give her that time to relax and really just release through the pole, through the jaw. Sometimes their tongue will come out and they'll just be like super, super chill. All right, and now we move into our 9th and 10th position. Just the 9th is the right side, the 10th is the left side, and it gets to the point of the shoulder. I also really like this position because it really gets right into the base of the neck and the spine as well. A lot of horses, as I work with mostly the hunter jumpers, really appreciate this position. So I just run my hand down, I pick up the horse's foot, I place it through, and I do proceed with caution a little bit as it's their first time feeling this. And it may prove to be a little too much, it may be a little bit too weak, and you watch, and here we're starting to get some nice reactions. I don't put a ton of tension on until I know that they're going to be comfortable with it, because you are doing double strength with the loops together. So I just give her the time, and here again I do anywhere from 2 to 4 minutes. I average 3 minutes per horse for a full body treatment per zone. And then I have the chance to double up if I notice any major issues or if the owners inform me of any injury or any problems that they've been having. Okay, and the final position for our full body protocol is just the other side of the point of the shoulder. So again, even though I've done one side, I always start off a little bit slowly here as I'm getting up into their area, because you know you're putting your foot through the coil and they're doubled up, so it is a little bit on the stronger side. So you just want to make sure you have your settings correct. And we'll just let this stay here for its 3 minutes. So I'm quite glad that I discovered the pulse centers for the PEMF. I found PEMF through a friend, actually a trainer was telling me about it. So I went home and did a little bit of research on my own, and I found a few different brands available out there to choose from. I decided for a few different reasons to go through pulse centers. I placed the order and got my machine, and I found the support to be quite good on the training side of things. I'm really looking forward to being able to do the advanced training in March. So I've moved into the small coils now. This horse experienced a bit of a bandage bow. So we're just going to attach this down into her suspensory and ligament area. She's not had this on her leg before, so the machine is not turned on. And I'm just going to let her get adjusted to it. She thinks I want to clean her feet probably. And then I'm going to just put the Velcros on. Okay. Good girl. No, bad girl. All right. So once we've got that attached, I have the machine turned right down to nothing so that I can turn it on to get started. And down here on the lower legs, you can actually go a little bit higher than you would. There's less muscles to react, and it gets a little bit deeper to get into that tendon. And I just, again, watch for all the same signs of comfort, relaxation. And we'll just do a few minutes there. Treatment with times would vary on a specific injury. You can go, again, your baseline of 3 minutes. You can also leave it on an injury on low and slow to get a nice long treatment for her to help really get the blood flow down to areas that are difficult to get blood flow to help improve that injury. So now we've moved the coils down and we've got it down around the fetlock joint. So that's a great location. This horse did race, so there is probable concussion from the racetrack. So she probably has some kind of feeling in there that this might help reduce any inflammation or any irritations that's down there. In older horses, it can really help reduce the inflammation caused by the arthritis that gets started. Again, you're just looking for the same signs of relaxation and acceptance on the leg.